The 2021-2022 Fiscal Analytics Snapshot highlight changes in the macroeconomic and public financial management in Nigeria arising from the pandemic. As a result, the study examined changes in Nigeria's growth, investment, consumption, poverty, revenue, expenditure, and debt sustainability before and during the pandemic. In the expenditure section, we examined four main segments. Further, the study reviewed changes in institutional framework that guide budgetary processes in Nigeria. The evidence in the study indicates that the impact of the pandemic was lesser than expected, although the adverse effects on the economy would still be evident over the next few years. A situation which has been confided as long COVID. COVID-19 had a very harmful impact on the Nigerian economy, resulting in rising unemployment and poverty. However, higher oil prices and the government's macroeconomic policy responses has moderated its effect, and the economy has begun growing again. Fiscal pressure has been alleviated, for the time being, not by improved management of the public finances per se, but by the rise in oil prices since the height of the pandemic. We are highlighting 6 core central messages emanating from the study. Nigeria's economic growth was already weak before the COVID-19 pandemic. GDP growth averaged only 1.2% between 2015 and 2020, resulting in GDP per capita declining every year after 2016. At the onset of the pandemic, GDP was forecast to decline by 3.2% in 2020, but the actual result was a smaller decline of 1.8% on account of higher than expected oil prices and resilience in the agricultural sector. The COVID-19 pandemic led to a rise in unemployment. Nigeria's unemployment rate rose from 27.1% in 2020 Q2 to 33.3% in 2020 Q4. Unemployment and the slowdown in business activity help explain why consumption per capita fell at an accelerated rate in 2020 and will continue to fall into the future, at least in the medium term. Budget execution has improved in recent years. Expenditure exceeded allocations in 2015, with capital expenditure of twice the initial allocation. Between 2016 and 2018, average budget execution at the aggregate level was only 85%. In 2020, budget execution was 90.1%, where levels closer to 100% show improved budget execution. Environments and reallocation of budget items are not reported, therefore a complete picture of budget implementation is not clear. Further, implementation challenges are sometimes due to liquidity shortages, as capital expenditure can be easily delayed when compared to recurrent expenditure. Nigeria's long-run fiscal situation is weak due to poor collection of non-oil revenue. Oil revenue, which makes up a significant though declining share of the resources available, is volatile. Pre-crisis, Nigeria was collecting about 8% of GDP as revenue. Following the pandemic, this has fallen closer to 7%. Expenditure was consistently above 12% of GDP and has recovered to this level, even after the decline during 2020. The result is a wide deficit of more than 4% of GDP. As a result, debt levels are increasing slowly and are now higher than expected before the pandemic. A direct consequence of limited public revenue and rising public debt has increased debt servicing in place of public investments. Resources allocated to health are very lean and may be significantly underspent. The allocation to health has been roughly 4% of the total budget over the past 5 years, but how much is spent is not known because current data is not available. Further, more than 80% of public expenditure on health is for payments to recurrent spending, thereby leaving too little for health infrastructure. However, the economic sustainability plan developed at the height of the pandemic prioritized the health sector. As a result, the plan seeks to build a resilient health sector based on 4 key priorities. Boosting the response to the COVID-19 pandemic. Ensuring every Nigerian has access to quality health services, particularly primary health care. Building preparedness for the threat posed by infectious diseases. Boosting local research and development efforts aimed at the production of medical and pharmaceutical products. The 2021 and 2022 budget process maintained the new January to December cycle. The 2022 appropriation bill was passed by Parliament in December 2021 and assented to by the President in the same month, ahead of commencement of the new fiscal year in January 2022. However, the timeliness of audited budget to ensure effectiveness and compliance with appropriation has not improved over the years. The audited budget for 2019 was submitted to the National Assembly in 2021 and is not yet publicly available. Given the above, the following issues warrant close monitoring over the coming year. A perennial issue for Nigeria is the need to collect more non-oil revenue. Capacity needs to be developed to do this. Collection rates can be monitored, although in the short to medium term, fiscal outcomes will be determined more by international oil prices than by any domestic developments. Therefore, it will be interesting to monitor any concrete steps taken to expand non-oil revenue generation. Whether recent improvements in budget credibility are maintained or not. There was quite a high level of credibility in the 2020 budget. The execution rate was about 90%. It will be interesting to see whether this continues into the future. If so, it means debates about what is included in the budget have real meaning, and are connected to what is actually implemented. Will primary care be the new priority in health? As part of the Economic Stability Program, the government's response to the COVID-19 pandemic, the government has decided to shift the focus of healthcare provision towards primary care. It will be important to monitor whether government's health allocations are executed.